Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we are going to talk about intermittent explosive disorder, which is a type of impulse control disorder. Intermittent explosive disorder is also known as IED, that's the abbreviation. It is characterized by some bouts of or episodes of intense anger in an individual. The individual is otherwise normal, but suddenly, because of no obvious reason or because of very small issues, the person might lose temper, and as he loses temper, he may become verbally and physically abusive or aggressive. And when I say he might become verbally aggressive, he might utter slangs, he might utter words which are not acceptable or which this person is not used to otherwise. As I said, he might even get physically abusive. He might hit somebody in the process, he might harm animals, he might damage property, or he might hurt another individual. Intermittent explosive disorder is quite common, and it's commoner amongst males as compared to females. The primary cause of intermittent explosive disorder, or IED, is a combination of biological and environmental factors. Amongst the biological factors, we must mention an imbalance in the level of serotonin in the brain. Apart from that, sometimes impulse control disorders, also intermittent explosive disorder in particular, might also result from some kind of genetic vulnerability. However, it has been noticed and observed that the environmental influences are quite huge so far as the causation of this disorder is concerned. Sometimes when children grow up in environments where one individual or more than one individual shows bouts of aggressive outbursts and abuses verbally as well as physically, then this child who's growing up in that environment imitates the behavior of this person who's suffering from IED, and then later this becomes a habit in this individual, and he actually does not learn how to control his own temper. He does not learn proper problem solving skills also. So this person later can develop or becomes more susceptible to develop intermittent explosive disorder. Intermittent explosive disorder can be the cause of fights, injury to oneself and to others, destruction of property, disturbed interpersonal relationships, divorce, so on and so forth. The treatment of intermittent explosive disorder can be through medications as well as through non-pharmacological methods like counseling, psychotherapy, relaxation techniques, etc. Medications can be of various types. They can be anxiolytics, they can be mood stabilizers, and they can be antidepressants. And amongst the non-pharmacological approaches, we use counseling, psychotherapy, hypnotherapy, and insight-oriented psychotherapy, where a person is made to realize how he can control his temper, how he can increase his self-awareness. And he's also made to realize that there are better problem-solving skills, and he's taught anger management skills. Apart from this, relaxation techniques like Jacobson's progressive muscular relaxation, deep breathing exercises, yoga, meditation, or anything that relaxes the body and the mind can be helpful in case of intermittent explosive disorder. And we must say here that sometimes bouts of increased temper is known to family members and to friends, but they do not know that there is a solution. They think this is a personality trait which will never change. And as I told you earlier, it can be treated effectively. Therefore, if you see a person who shows bouts of aggression, like I stated earlier, he may be suffering from an impulse control disorder like intermittent explosive disorder. So immediately take him to a psychiatrist or a psychotherapist or a counselor. I'm sure he or she will find a proper solution in such places. Do remember to like this video or subscribe this video, and we promise to come back with something as interesting as this. Till then, take care.